Hi guys, my name is Scott. I am the lead veterinary surgeon at Barton Veterinary Centre as part of DNA, and I'm here today to talk to you about Brachycephalic obstructive airway syndrome, or BOAS for short. So, what is Brachycephalic obstructive airway syndrome? So, brachycephalic literally means short nose. So we have brachycephalic animals like Frenchies, Bulldogs, Pugs, Boxers, Boston Terriers, where basically instead of their skull being this big, it's been squished to this. Now that can have a number of different knock-on effects in terms of how they breathe, in terms of the position of their eyes, in terms of their, you've all seen they've got quite thin nares. And that can have a number of different things. Now we know more about BOAS animals and the health implications that it does have now than we've ever done, and I think there is a lot more information out there about them, but equally we have to help the ones that are struggling with the condition. Unfortunately, that is just a result of how they are proportioned. So the signs to watch out for BOAS syndrome are snoring, regurgitation. So a lot of Frenchies can have this thing where they kind of can be running around and all of a sudden they can just kind of stop and go like that, and then they'll keep going. Now what we think that is we think that's a degree of what we call esophageal reflux. So where you get a bit of basically heartburn, a bit of stomach acid comes into the esophagus and then drops back down, but it can make them feel quite sick. They can suffer from sleep apnea, where they can't breathe properly because of their position of their face. They can also obviously suffer in the heat when it is really warm because they can't thermoregulate properly. And that can lead to some pretty scary things happening, especially in the warmer weather. So a lot of the time we get, Frenchies, Pugs especially, coming through with symptoms of heat stroke. And the reason why they are more predisposed is because they have less surface area in their mouth, they have less surface area in their face, but they have the same level of structures present there, which means they can't cool themselves via panting like your other dogs can, like your Labradors and your Whippets and your German Shepherds, because they have a much wider area of conjunctival mucosa, which is your gums and the roof of your mouth, to allow for heat to dissipate out. The problem we have with a lot of brachycephalic breeds that we know have BOAS is there is a large amount of owners who aren't aware that it's actually a health condition. We get a lot of people coming in kind of going, oh, it's really cute, they snore a lot, or when a lot of animals that do suffer from brachycephalic obstructive airway syndrome, when they're asleep, they'll sleep with their head outstretched, or they'll sleep with a ball in their mouth, and it looks really cute. You see it on Instagram, you see it on TikTok, you see it on all the social medias, going, look at my cute dog fell asleep with a ball in its mouth. That's actually that dog sleeping with its mouth fixed open so it can get more oxygen in, because it can't physically get the oxygen through its nose when it's asleep. So it's not quite suffocation, but it is a mild form of it. They're just trying to allow more oxygen in. If you've got a dog who is suffering with BOAS, you can hear them coming a mile away. You can hear them walking down the street, that kind of sound. And that is a big indicator that these things are happening. Physically and anatomically, there's a couple of different contributing factors to this. So the number one is they often have pinched nares, so those are pinched nostrils. So if you ever look at your Labradors, your German Shepherds, they have really wide nostril openings, whereas you look at your Pugs and your Bulldogs and your Frenchies and your Bostons, and they have very narrow nares. And that will obviously impede airflow going through the nostrils into the back of the air, into the back of the throat. So that's number one, they can't get the air through the nose as well as they should be able to. Number two, they often have something called an elongated soft palate, which is basically a tissue at the roof of the mouth that is longer than it should be, and that can interact with what we call the epiglottis, which is something that covers the airway when an animal's swallowing. And essentially, if that's rubbing or interfering with the epiglottis, it can inhibit breathing. And over time, because it's got that irritation, it gets thicker. And it's kind of a knock-on effect. Because it gets thicker, it causes more occlusion. There are a couple of other things that happen as a secondary result of these issues, but those are kind of some of your more primary ones going on. In terms of each assessment of the individual, we often do have to sedate them to be able to examine the back of the mouth and to be able to examine the entrance to the airway. And that will allow us to dictate where we go down in terms of surgery. We will often take chest x-rays to make sure what's going on, but primarily we will be able to get these things sorted at the same time we do the initial investigations. In terms of treatment options, there are surgical corrections available. That will be up to yourself to discuss with the vet to be able to kind of make a plan of attack with where we're going. A lot of the times we do find that owners do have a very good satisfaction after the op. Personally, I had one owner say to me that they hadn't not heard their dog snoring for 2 years prior to doing the op, and they couldn't sleep for a few days afterwards because they were so used to the snores. The dog is doing amazingly and everything is great, but it can be a major difference in quality of life. We can do various assessment tests to make sure what the animals are like and how they are. Ultimately, if you are worried about your dog having brachycephalic obstructive airway syndrome, book a consultation with your vet and we will go through the options and go through the details and what is involved, greater than the scope that I can give in this short video. But if you are concerned, please contact your vet and we will do our best to help you out. So if you are wanting to get booked in for a chat with myself, then please give us a call on 01652 636 359, and obviously you can have a look through things and decide if you want to get booked in or not.